It is well established that people with lower income and lower levels of education are more likely to use tobacco products. As an analysis by the Lung Association showed that income and education significantly contributed to higher levels of cigarette smoking in rural areas. As the amount of education and income increased, the rate of smoking decreased. Surprisingly, smokeless tobacco use across income or education in rural areas didn't follow this pattern. When you go over to tobacco industry marketing tactics, we have a lot of good information. Tobacco products are one of the most heavily marketed consumer goods in the United States, period. In 2008, tobacco companies spent $9.94 billion on the marketing of cigarettes and $547 million on the marketing of smokeless tobacco products. For decades, the tobacco industry has done a masterful job targeting the market, specifically certain products to certain populations, including blue-collar, rural men, of course, are some of their best customers. Ads depicting rugged, manly images of cowboys, hunters, race car drivers are carefully placed in the media and retail outlets, most likely to reach their audience. So let's talk about the current tobacco control environment. On page 9, it highlights, after about 50 years of efforts by government agencies and public health advocacy organizations, there's a strong consensus on what policies and programs are effective in overcoming the power of the tobacco industry and reducing the toll of tobacco use on public health. According to the Centers for Disease Control and Prevention, strategies that have proven effective include increasing the cost of tobacco products, implementing smoke-free policies for work sites and public places, counter-marketing campaigns, providing insurance coverage of tobacco use treatments, and limiting children's access to tobacco products. If you've had any experience in that, will you just raise your hand? Any experience in any of those tobacco control policies? Yay. We know that the tobacco control environment, it's hard to work in, but it's well worth it. So thank you for what you're doing in all of these policy measures. Our whole purpose is to reduce the use of tobacco, to reduce the exposure to secondhand smoke, and we know that policies change behavior. I just wanted to point out 2 graphs here on our smoke-free air policies. Over here to the right, you see on the top, we have the percentage of state population living in rural areas is the map in green. The highest percentage rural is a darker color, and the lowest percentage rural is the color white. Right below it is in orange, the adult smoking prevalence map. The highest smoking prevalence is the darker color, and the white color is the lowest smoking prevalence. And the last map, strength of smoke-free air laws. The weakest smoke-free air laws mean they don't exist or there's no statewide law, is the darkest colors, and the states that are white have comprehensive smoke-free air laws. As we look at these maps, and if we overlaid them on one another, you would find some evidence and correlation. That if there's a high use of adult smoking prevalence without a policy that reduces and influences tobacco use, you see there's some major correlation. And then when you see the states where there's rural areas, there's also some similarities as well.